Okay, so I thought that since the part two of our integrative course is coming up, we might review kind of the thought process and the flow
Okay.
for what happens when you have a complaint in the distal extremities. So, for
Okay.
example, if somebody's complaining of a wrist pain, an
Mm-hmm.
elbow pain, and that pretty much is their primary complaint, at
Mm-hmm.
least from what I understand and my perspective is, of course, you're going to still screen their cervical spine out first.
Mm-hmm.
Um, and even you'll include a spine of a screen of the thoracic cage or thoracic spine as well. But
Yes.
once you kind of clear that up and you're sufficiently have cleared the spine, you of course you're going to go back to their complaint at their wrist and or their
Yes.
elbow, and if they still have significant symptoms, what is the thought process?
Okay.
How are you getting at that?
So the thought process is that you gather all the symptoms that are still in existence. You put them together in a working syndrome. And you will have to, you can define that syndrome either according to known syndromes that have been discovered or defined before, or it will be a syndrome that suits you. It is a shoulder, wrist, an elbow syndrome with these symptoms. Um, in addition, you will look at the systems that will be the tissues that are likely to give similar or this kind of symptomatology. So that will help you to decide what you have to treat. Is it a nerve compression issue or a traction in injury? Is it muscular? Is it a ligament or cartilage injury? Is it a joint problem, an impingement syndrome, for example, and so on? Or do you think this is linked to a digestive insult? Somebody, as I said, might have something wrong with their liver and they have shoulder pain, or
Hmm.
it is starting to give something like that. And we must remember that there are several levels of interrelationships or relationships between tissues. Or you can have a spinal level, subcortical level, a cortical level, and so on. And these can be more complex than the traditional orthopedic um, relationships that we see. So once you have decided what is the most likely system, you're going to stress out that system. You're going to start testing those components that belong to the system, and you see if you are making a difference.
I think that and that's part of the rub here is
Yeah.
the idea that you know if somebody has pain in the pain at the wrist or forearm, the idea that you know just offhand, I have my ways of provoking the nerve or
Mm-hmm.
provoking the joint or provoking the muscle to kind
Mm-hmm.
of differentiate, rule in, rule out. That's, frankly, something I don't necessarily immediately have, uh,
Mm-hmm.
on hand. And then
Mm-hmm.
when you couple that with how many patients are complaining of primary kind of wrist complaint or something,
Mm-hmm.
it's not like I'm seeing that every day all day.
Mm-hmm.
So this is where I think the clinical difficulty comes in, where it's that patient who might have that problem. I obviously competent in clearing out the spine and the shoulder issue, but with them, and they still have these little nitty gritty things in the distal extremities that maybe I don't have such a good handle on.
Mm-hmm.
It's hard. It's one thing to just in my mind say, okay, yeah, well, first I'm going to see if this is a nerve impingement issue that could be causing the pain in their thumb. Oh, and then I'm
Mm-hmm.
going to check if it's a joint issue. But then when it comes to the actual practical doing of it,
Hmm.
And I have to go. I have to say, Robert, how are we testing the nerve into the thumb, or
Hmm.
how are we testing the joint problem for the thumb?
Hmm.
That's unfortunately just the reality, at least for me. Um, but what you're describing is at least starting to put things into context,
That's
into a
right.
rational context, to
That's
say,
right.
this is how you go. You go
Yes,
step by step by step. And once you get to the local, it's still a matter of, we have a nerve impingement issue, a joint issue, a muscle issue, a tendon cartilage issue.
that's right.
And then it's just a matter of gathering some
Fine,
more
gathering
clinical
it, and
experience with each of those
yes,
things.
yes. And that is why one should be just reading up on what are the common and uncommon syndromes of the upper extremity. There's a lot out there, so it behooves us to keep on looking and cataloging in our minds what do these look like, and to make sure we make good notes so that we can start to see patterns or relationships between patient X, patient W, patient B and C, and so on. And that is really how you can amass a functioning encyclopedia of treatment choices. The tissues that are involved then determine your treatment techniques, because they that automatically self chooses the appropriate treatment technique. So if you have a nerve issue, then you're looking at neurodynamics and so on. If you have a muscle issue, well, you have 101 different types of muscle treatment, from strain counter strain to stripping to pressure treatments to muscle activation to neuromuscular
Can you put
techniques.
dry needling into that category?
Yes, you have all that at your disposal. And dry needling can be used for different tissues too, because this is, again, we're looking at afferent input. And we must remember that afferent input cuts across several systems, it cuts across all systems.
Hmm.
So after you have then treated, then it is time for restoration of movement and restoration of function. And that is where you are now going to make sure that the spherical joint is well
Okay.
centrated.
Okay. Here
Yeah?
we go. Here we
Now,
go. Yeah.
just a caveat.
Yeah.
If in my assessment I suspect that the joint issue is primary, then I would centrate that joint as much as possible to see what effect it has. So in screening for systems, I already know if I'm centrating the spherical joint as a priority or it is
Hmm.
not a priority, because it is either
Okay.
centrated or the decentration is mild and would not cause these kind of symptoms.
Okay.
So in choosing the systems, the priority of the center of the spherical joint is automatically included, and you will treat it first if it is what you should do, or you will treat it secondarily when it comes to restoring function to the limb. And
Okay.
from that moment on, you are now in the actual movement strategy mode. Now, in addition to that, not only must you centrate the spherical joints, but you must make sure that the main muscle groups are not inhibited or dysfunctional. So, working knowledge of the muscle tests for the upper extremity is needed, and you will start working that into your movement strategy, and how you will bias the movement choices to activate or inhibit a muscle or stretch a contracture and so on. So that
So
is
let
the
me.
flow.
Okay, yes. So let me.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.